Chronic kidney disease, or CKD, affects millions of people worldwide, often progressing silent. So managing CKD before it leads to dialysis is crucial for a better quality of life, as protein metabolism becomes an added burden with individuals who have CKD, as it can accelerate progressive decline in kidney functions. How does this happen? Because protein is the source of nitrogen in the waste generated by the kidneys. Interventions that slow down the progression of kidney function decline and delay the initiation of dialysis for patients living with CKD are essential for a better quality of life. Renastal tablets, a breakthrough nutritional therapy that is beneficial for CKD patients. Renastal combines keto analogs and essential amino acids to prevent and manage the damage that results in faulty protein metabolism. Renastal as a tablet, taken with a very low protein diet, helps slow the progression of CKD, thereby reducing the risk of initiation of dialysis. By replacing essential amino acids without adding nitrogen waste, Renastal can help you maintain the protein balance your body needs whilst protecting your kidneys. Renastal, you are not just managing your kidney health, you are improving your long-term well-being. Ask your doctor if Renastal is right for you, because together we can take steps to protect your kidneys and improve your life. Renastal, helping you live better with CKD. For more information, contact the Circle Direct podcast on YouTube.
Hello, how well do you know about kidney failure and chronic kidney disease? Let's scratch that. Let me rephrase the question. How well do you know about the functions of your kidney? And are you aware that if you do not manage your kidney adequately, it can get damaged? I came across a concerning study recently, and it's about the lack of knowledge amongst many individuals about the functions of their kidneys, and that if they don't manage the kidneys very well, it can be damaged. I mean, how as you explain the part that if you go out today in our society, if you go to parties, if you go to clubs, you still see people engage in activities that are deleterious to their kidneys. You see people still doing binge drinking, even though it affects the kidney in the long term. I mean, if you go to our streets today, you see people selling all kinds of herbal products and people buy it. And they don't know what is in there, but they still take it, even though some of those substances can be harmful. You know, the most startling of them all is the part that a lot of people still do not undergo routine comprehensive testing in our society. So they lack the knowledge of their health status. They lack the knowledge of the risk factors like hypertension and diabetes. And they don't even know if they are predisposed to those factors at all. Chronic kidney disease is a long-term condition characterized by a progressive, irreversible loss in function of the kidney over time. The kidney's function is to take waste out of our system. And when the kidney loses that function, it causes a lot of health issues. And most times it's a silent danger. People don't know that they have the condition until significant damage has been done. And CKD, chronic kidney disease, has two highlights: hypertension and diabetes. So in most cases, you see that as a result of long-term hypertension and long-term diabetes poorly managed, and that results in CKD. And the thing about these two risk factors is that they've got to do with lifestyle choices, which means it's got to do with how you eat, if you've been eating poorly for a long time, and how you handle stress, if you've been badly handling stress for a long period, and if you've the degree of activities that you've been involved in, as in whether you've been doing exercises or you've been living a sedentary lifestyle. So what happens in these cases is that it's a buildup of decades that results in this condition most times. Now, routine comprehensive testing becomes a very proactive measure to mitigating or preventing the condition. So when we talk about routine comprehensive testing, we are not talking about you doing a cherry pick, picking 1, 2, 3. No, we're talking about a holistic approach to testing, where you test your body from top to bottom. Now, some of the key tests that you can do with regards prevention or detecting CKD. In the blood test, some of the tests you can do are the random blood sugar and fasting blood sugar, both of which are to determine whether the person is either pre-diabetic or diabetic, so that the doctor can take appropriate interventions to deal with the condition. It's important that those are properly managed. Other tests you can do is your kidney function test. And the kidney function test is measured in GFR. And anybody that reports it equal or less than 90 mils per minute is already CKD. And it's important that appropriate intervention is introduced on time. Then there's also imaging tests, there's lipid profile tests. There are a host of tests that we can do. But besides all of these tests, there's also lifestyle measures that we can imbibe as a way to dealing with this condition. Some of them include we got to control what we eat. What you eat has a long way in affecting your health. You got to shun binge drinking. Alcohol, for one, is a diuretic and it can cause the diuretic. Normally they take liquids out of your system, so it can result in dehydration. And consistent binge drinking that we see a lot of people do can in the long term lead to a kidney damage. Then there's also the part that alcohol, it can increase your blood pressure momentarily. And if you indulge in excessive drinking for a long period, it can, get someone hypertensive. So it's not good for you. You got to shun smoking. You got to shun a sedentary lifestyle. You got to cut down on substances that have high amounts of sodium, as sodium causes accumulation of fluids. Then you got to do exercise. Exercise is very important. So when we say exercise, we don't mean that you should over stress yourself, but rather you can do simple things like aerobics, brisk walking, and you can do it steadily. The most important thing is that you got to be consistent, and it can help your blood flow and your heart function on the long term, which will ultimately improve your quality of life. So those are some of the things that we think that you can do to help yourself and to prevent CKD. And if you've not been doing routine comprehensive testing, today presents another opportunity for you to go out there and try and test yourself. Go see your doctor, and we recommend those tests. We can defeat chronic kidney disease, but you got to be committed. Thank you.